if you think back several years, it was usually frowned upon if you saw somebody behaving differently from what people looked as the norm.
Exactly.
So there was the world or the cultural expectations of this is the right way to behave. So people framed things like, this is what you must be doing.
Yeah,
this is how you
standard,
must be. And if you think back as when we were children, growing up, if you were different, doing something different, your parents will frown at it.
Of course.
And you'll be told off by family members, what's wrong with that child? Why are they behaving like that?
What if the way your brain works, the way you learn, move, feel, and connect, isn't broken, just different? What if that difference isn't just a personal trait, but a systemic battleground? In 2024, 1 in 7 people across the globe are diagnosed neurodivergent. Yet only about 32% of adults can even define what neurodiversity means. That gap isn't just ignorance, it's a barrier to diagnosis, support, dignity, and opportunity. And it's costing the world trillions in lost potential. Today, we're peeling back the layers to uncover the real story behind neurodiversity. From ADHD to autism, dyslexia to dyspraxia, these are not flaws. They're different ways of experiencing the world. Yet too often, they're misdiagnosed, dismissed, or dangerously romanticized. In this episode, I'm joined by consultant pediatrician Dr. Inyang, an expert in chronic neurological disorders and assessment of children with autism and other neurodevelopmental disorders, whose work spans the UK, Africa, and the Middle East. Together, we dive deep into the complexities of neurodiversity, from outdated diagnostic frameworks and medical blind spots, to the emotional cost of masking, to the overlooked genius that comes with difference. Whether you're a parent, educator, policymaker, or someone seeking to better understand yourself or a loved one, this conversation will challenge what you think you know. This episode isn't just about diagnosis or labels, it's a call to rethink how we understand difference and to recognize the brilliance within it. Let's talk about it. Can We Talk starts now.
So I was just going to reel out some stats that I have and just hear a perspective about it. So there's 1 in 7 people globally are neurodivergent. And this from the CDC and WHO. And they also say like untreated ADHD results in more than 143 billion per year in economic burden. That's for the US. And I think for the UK, it's about almost 2 trillion. That's the cost of ADHD. Then also about 85% of autistic adults are unemployed or unemployable in the UK. And that's from National Autistic Society. That's the 2024 report. And a YouGov data says in 2024, says only 32% of UK adults could correctly define neurodiversity, which means more than 68% of the population don't understand ND or neurodiversity. I mean, from this, data, that means like in a friendship group of about 7 people, one of them at least most likely has got ADHD or, some form of neurodiversity. And expanding that again, like in a more, like in the concept of family, like a family, of about 7 people, that means at least one person in a family or more could have this. But yet, less than 50% of the population know about it. Here, saying about 32% in the UK. And I feel like in other climes, like in Africa or the Middle East or other climes, it might be a lot even lower. So why is it as ubiquitous as it is, why are people not necessarily informed about it? Why do you think there's that information gap or knowledge gap about neurodiversity as a subject area?
Yeah, so it's a very interesting thing. And I think that if we look at it at different levels, so even starting from the population level, if you think back several years, it was usually frowned upon if you saw somebody behaving differently from what people looked as the norm.
Exactly.
So there was the world or the cultural expectations of this is the right way to behave. So people framed things like, this is what you must be doing.
Yeah,
this is how you must be. And if you think back as when we were children, growing up, if you were different, doing something different, your parents will frown at it.
Of course.
And you'll be told off by family members, what's wrong with that child? Why are they behaving like that? So you see that society had already framed a behavioral pattern of what is norm. And And therefore, shifting that base to tell the person that actually that child that is jumping around, that child that is screaming,
Yeah.
could be distressed for a particular reason, not because they're being naughty or disruptive,
Yeah.
but there's a reason for that child who comes into the supermarket and is screaming and screaming and screaming. Everybody looks at the parents and
Yeah.
say, why, why are
Sort
you
this
sort
child
your
out, yeah.
child out? That's typically what parents get. They sort your child out. They look at you as a bad parent. So that stigma, which parents of children who had those difficulties, made it, very difficult to actually, for people to identify that actually something real could be going on here.
Yeah.
And even within the family framework, even between parents, you would find that a family member would feel that there's something not right about the child, and the other parent would say, sort yourself out. You're the cause of that problem and all that.
Yeah.
So there was all this blaming intra-family. There was all the outer family expected behavior. There was a society expected behavior. And so people did not have any tolerance for that.
Yeah.
Now, when things started, the discussion started coming that people, these conditions were caused by, a known, that there was a reason.
Yeah.
We were not helped by the media. So if you take many newspaper articles, Daily Mail in the UK, for example, demonizing actually children, families, and saying, oh, now they've given it a name. Clinicians are there giving children medications, or, there was the societal aspect, the media aspect did not really, the cynicism within the media did not also help.
Yeah.
So many parents were hesitant about seeking help because they almost felt, am I doing the right thing?
So we're gonna get right into that. So for a person who has tuned into this now, and obviously maybe from the thumbnail or the introduction of this episode, and it's like, oh, okay, I find this quite interesting, but who's this person? Like, I've been hearing a lot of content creators and a lot of people talking about neurodiversity, and like, who's this person? Like, what's her background? Like, what reputation or standing does she have to to speak authoritatively about this topic? So can you just just give us a background about yourself and your qualifications or your expertise in this in this subject area?
Okay, so my name, my professional name is Inyang, Dr. Inyang. So I've been a pediatrician for over 30 years, and I did my undergraduate degree in Nigeria in University College Hospital in Ibadan. I also did professional postgraduate training after that for 6 years in Nigeria. Before coming over to the UK. So I was already qualified even as a consultant in Nigeria.
Brilliant.
I did a master's in public health in Nigeria as well, because I was interested in the public health aspect. It was while I was in Nigeria, because there was nothing known about this at all. There was nothing neurodevelopmental in our training. There was nothing like that. But I got interested in the outcomes of children that we were seeing, particularly the newborns who had been admitted for several birth injuries and things, and what happened to them after. I saw that these children presented in different ways, but we didn't understand them. We didn't know what was going on. We would see children who were running around hyperactive in the clinic. We didn't have a clue. We were professionals working in a very big tertiary institution. We had no clue. So that was one of the things that made me want to come and study this more. So I came to the UK, through a scholarship to the University College London, where I came and did a master's at the University College London way back now in late 1990. Yes, UCL. I did that for a year, and one of my main interests had always been neurology. I did a lot of that in Nigeria, but I was interested in the neurodevelopmental aspect. So I decided to do further training. And my master's year was full of that training. But I decided to specialize again clinically in that field. So I did further training in the UK. I worked in big hospitals like Great Ormond Street Hospital, doing neurology and epilepsy there, got more interested. And then I got my consultant job where in the current hospital where I worked for 20 years as a consultant.
So you know what you're talking about.
So I know what I'm talking about.
Whatever we discuss here now is coming from a place of, lived experience and also, scholarly, accomplishment. You're a consultant. So we've established that now that you know what you're talking about and you know your stuff. Brilliant. Okay, so that's been established now. So again, just circling back to the YouGov data saying about barely 32% of the UK population, and like I said before, it could be worse in other climes because I think the UK is more advanced in the knowledge and education regarding this neurodiversity and the likes. So in other climes where it's not necessarily a conversation, it's not necessarily something in mainstream media. Again, so if you want to describe neurodiversity to the average person who's not necessarily informed or engaged in that conversation or aware of the the nuances of it, how would you briefly and effectively describe it to the average person? Because again, it's like there's so much misinformation and so much complexities and gray areas regarding this this topic. So how will you describe that neurodiversity to someone who doesn't necessarily understand or is not aware of it? How would you break it down to the average person?
Well, what I usually say to people is that we are all different and we are a product of genetic makeup,
of course,
as well as the whole process of why we can walk, talk, and do things is all controlled by our brain. Now, our brain is it's almost like a huge computer made up of different wires. And those wires are connecting to make things efficient. And it's a connection of the wires that makes us be able to walk, talk, speak appropriately and all that. Sometimes in the process of conception, it's almost like there is a shaking and sometimes those connections or those genetic makeups are not the way it should be. Sometimes things fall off from the time that there's conception. There's sometimes little breakages
from conception.
I'm just saying, talking about the genetic aspect.
Right, okay.
So the genetic aspect that contributes to this is that sometimes there's some changes in the way the genes are. When you've got fertilization, you've got, the embryo, it's multiplying and all that to create the complete human being.
Of course.
And it goes through processes. You've got a process where the brain is formed, you process where other things are formed. Sometimes in the process of all that shaking, and there's a lot of changes going on, sometimes things happen during that period where it could lead to difficulties later, which might not be evident when the child is born. So the child might be born, look completely fine, but is in the process of that development. Sometimes some of the things that have happened in that whole process of where it may result in that. Also, looking at the brain, our brain is full of, wiring. I look at it like a computer box.
Of course.
Plenty of wires connecting one to another. If you turn your computer on, you expect it to be clear, to show the light. If there's something that's not working well, there'll be something not showing up properly on your computer. Sometimes the wiring in our brains is like that. Not connected the way it should. There's been maybe little problems along the way, but you still have the full person, you still have the full human being. And sometimes those things can affect the way we tolerate things in our environment. It can affect the way we handle noises, the way we communicate with other people, the way we tolerate things around us. So those behaviors, those things that happen as a result of those transmission difficulties, those genetic difficulties, can result in differences in the behaviors that we have. So that's why one person might not be able to handle certain environments, might find things too overwhelming, because what you can perceive as okay noise or okay sounds might be very distressing to the other person because they can't filter it. And think about yourself. If you're somewhere where you are irritated by the sound, the noise, the smell, you're uncomfortable. You want to leave that place. And that is how it is with people who are neurodiverse.
Interesting.
You can't see what is irritating them. They can see it, they can feel it. But because you can't see, you can't understand why suddenly they start behaving in the ways they are. So a child who runs in, you take the child into the shop and the child starts screaming. That child may be affected by the light, by too many people, by the noise, and they're distressed. And their scream is, take me out of here.
Yeah.
I want calm. But you don't understand. You're saying, what's wrong with you? Just keep coming. And the child is getting more distressed.
Yeah.
So there are reasons why people behave in different ways from what we expect. So neurodiversity is just the diversity in behaviors, in people's expressions, in the way people do things, which stems from either genetic, or things that have happened along the way to affect the brain transmission.
Yeah.
So I've talked about genetics, I've talked about family, but things like when a baby is born, there are different things that could happen from the pregnancy area. If mom wasn't well in pregnancy, it could affect that brain formation. If if the baby was unwell, it can affect that brain formation. If the baby was starved of oxygen at birth, say for example during delivery, the baby had to be delivered because he wasn't getting enough oxygen, the brain could be affected. And that child that is born could have the potential of developing any of those neurodiverse conditions because the brain, which harbors a lot of those networks that we're talking about, has been affected. So that baby could come out looking very fine, and then gets to the time when they start developing and doing things. And then you start saying, because that's the time when those nerves should be doing the things they're doing, but there's been a difference of the way things are happening. So when people see people who are neurodiverse, take a step back and think, this behavior, what's the child trying to communicate? Try and understand, why is that person doing that?
Yeah.
So for people with ADHD, for example, the network is such that they're receiving the messages, but they cannot put the brakes on.
We're gonna expound on that, because again, like you said, it's a very broad and complex conversation. Like as we've said, we'd have to split this into multiple episodes, maybe 2, 3. We'll see as it goes, because there's different areas, and I would like us to do due diligence to this topic. And anyone who's listening, I want hope for them to leave more educated, more enlightened, and maybe have more empathy. Even if you're the person who's manifesting all of these neurodiverse traits, or someone, it just kind of helps you just move differently with this new knowledge you'd hopefully have had. And there's a lot of conversation around nutrition, technology, spiritual, and different nuances to this topic. So how would you dispel or align all of these conversations regarding people saying, oh, there's just too many phones now, you're giving your children phones too early, and that's what's creating ADHD, or it's the milk, or it's the food, or they just need to take more avocado, or more this or that, or they just need to we need to anoint them, or we need to do deliverance upon them. So what's the scope of it? Briefly.
So I think, again, like I said, one of the great things about some areas of neurodiversity, like things like ADHD, is that people have done great research on it. And when we say research, they've gone right down to understanding how the brain in somebody with neurodiversity, like ADHD, is different from somebody without that condition. So we know what is happening. We know how the networks are working. We know that, there are fundamental changes in the brain, and that's why that's the basis of some of the treatments.
Of course.
Because some of the treatments work along those pathways to try and improve things. It's a bit like somebody who's got diabetes, for example. We know why the person's got diabetes. It's an insulin problem. So things that are being given is to modify that. Yes, you can try and help your diet and things like that. But when it gets to the time where you really need that medication, you have to take it. Otherwise, there'll be problems. So, yes, we know that when people are neurodiverse, that there are things that can help to limit the difficulties. So somebody who is neurodiverse and is in a nurturing home and is having healthy practices will help to modulate things. It doesn't remove it, but it just helps to modulate it, compared to somebody who's got ADHD living in a chaotic household where you're eating all the wrong things, you're not doing exercise, because exercise is good, for example. Exercise helps to improve your dopamine. And dopamine is one of those things that is transmitted that helps to improve transmission between the nerves in ADHD. So things like help to improve your dopamine levels will help to some extent. It's not curing it. It's just helping to improve the general well-being.
Okay, so to clarify now, it's not necessarily the food that is creating ADHD.
No, the food is not.
But good nutrition can help manage ADHD.
So good nutrition, good sleep, and then, exercise.
Is it the phones? Are phones making ADHD?
So phones do not cause ADHD.
Okay.
Phones do not cause ADHD. But what phones can do is, if you don't regulate it, it can disrupt things like your sleep. It can, you can just become hyperfixated on that. And therefore, you are not... Because the thing with people with ADHD is they like things that are visual. They like things that give them instant dopamine gratification and all that. So it's understandable when you see them being drawn to that. But you have to regulate it like every other thing and maintain a healthy practice. It's not causing it, but obviously giving that too much can influence the manifestation of some of the symptoms, but it's not causing it.
I think I was just trying to establish or dispel certain myths or certain assumptions and I'll say misinformation. And just moving on, your work spans, like you said, you've worked in the UK, Africa, and the Middle East. What some unexpected lessons that you've learned, about neurodiversity or family dynamics or, the healthcare practices across these different, cultural environments you've worked in? Are there certain differences in how it's understood or how it's implemented or how people or families react to it in these different environments?
Okay. So with the Middle East, I haven't worked there, but I go there to give, some talks. And I've got friends working in the field.
All right.
So I've got friends working in the Middle East who I know from here, who we do share experiences. And I do go there. So I have an understanding of the range of things that they do. I've worked in Africa, so I worked in Nigeria and all that. And like I said, the question you're asking is... So,
you've worked in these different environments. Yeah. What's the perspectives that people have in these different environments? Is it different or does culture impact how people, accept, I won't say accept, how they, understand and, approach, neurodiversity in these different regions that you've been exposed to via your work?
Yes, I can certainly say yes for Africa, because Africa there, where I worked in Africa, and Africa here, where I'm seeing people from Africa in the UK. And I will tell you, it's not much different. So even though people have moved cultures and have come here, majority of them still hold on to those beliefs. And it's very interesting.
What are some of these beliefs?
So, first of all, there's usually a hesitancy to actually acknowledge that neurodiversity is real. And so when you broach the topic, there's getting to be a little bit of shift now. But I remember years ago when I used to see, when I worked in Nigeria, like I said to you, we didn't really know a lot. Professionals didn't really know a lot about that. So, but when I moved here and I've been interacting with people where the children have concerns, there has been quite a lot of hesitancy, even amongst the educators in that society. So when I've seen children here where they're within a school, the educators themselves have told the parents, don't go and do that. Don't let them label your child. This can be sorted by going to church or going for deliverance or something. And there's a lot of faith-driven excuses. No, this is not, it's not your... Oh, that's very common. And I hear that from Africans here. It's not my portion. No, no, it doesn't happen. From all classes, highly educated, all classes. No, that's not my portion. No, that's not what's wrong.
Because there's a notion that, for people who are religious, that the Bible says, we are beautiful and fearfully made. Hence, we're perfect. So who broke my child, or who broke me, or why am I broken.
Yes.
You know, I should be perfect.
I hear that, but actually that same Bible.
Why am I a Christian and I've got ASD, or why am I a Christian and I've got, how does that play out?
So if you look at the Bible, and sure, when you study personalities of people in the Bible, you will see that there were neurodiverse people in the Bible.
We can go there. We can go there. Yeah. So moving on, I mean, when we talk about neurodivergence, I mean, many people only think of autism and ADHD. Is there more to the scope or the area of neurodiversity, or is it just ASD, ADHD? What's because that's, as far as I know, that's all I know, and I'm relatively informed about neurodivergence. So it's like, what more? Is there a wider scope to it? Is there more to it?
So there's a wider scope. Yes, ASD and ADHD are the commonest ones, but we have a wide scope. We have tic disorders, people who have tics, and if you look back again, people who had tics were present in Nigeria.
Of course.
I remember so much, even within my wider family, people who had tics, and people just thought, why is this person doing that? But the interesting thing about tic disorders is people with tic disorders have a high prevalence of those other conditions like OCD, ADHD, or autism spectrum disorder. Okay. So when you study those personalities, those people, you will now find that actually they were behaving in these ways and all that. So you have tic disorders. You have children who have neurodiversity as a result of different things. So one of the things that I do a lot is a condition called fetal alcohol spectrum disorders. Okay. And those are children whose neurodiversity has been caused by maternal consumption of alcohol during pregnancy.
Okay.
And they present with a wide range of difficulties.
Wow.
And the thing is, that discourse, if you think back on our society, a lot of things were normalized. It wasn't unusual for pregnant women to have
consume alcohol,
stout.
Yeah.
It was quite common.
Wow, so that's a factor.
So you can have those kind of things. When women are taking those things early in pregnancy, it can affect the brain of the child.
Wow.
It can affect the networks, the neurons.
Wow.
And it can affect how that child turns up.
It's valuable information.
Very important.
Because I feel like because a lot of people, I mean, I've heard situations where, maybe the child is moving a lot. They just tell the mom, just drink some alcohol.
Yes,
the child
it was very, very common.
The child would go to sleep, or the child would relax.
Yes, so there are many, and we do know that now.
So that can potentially have a very...
It can have a very, very serious effect on the child's development.
That's good information. So speaking of, diagnosing, people, or the framework of diagnostics, will you say we're operating with an outdated the framework for diagnosis, or will you say that the framework for diagnosis now, will you say is robust enough to cater to the nuances of neurodiversity in this present time that we are in? Or will you say it's robust enough, or will you say there's any improvement that you think might be necessary to consider, the scope of it?
I think the framework in terms of, so obviously there are guidelines for the diagnosis, and even people working in that field know that it's not, there's still room for improvement, because how it is does miss out on some people.
That's where I was going with that.
Yeah, so some people miss out on getting the diagnosis because of how strict those guidelines are. That hasn't looked at, for example, the emotional symptoms, which a lot of people get.
Or so even a lot females, how females
the females, yes, the females with ADHD, a lot of them get missed because they haven't kind of ticked the boxes. And even the young people, the adolescents, the older teens and all that, people, they could be somewhere and nobody would realize that actually this person is struggling a lot. And then suddenly you find somebody who doesn't want to go into school, who is finding the school setting overwhelming. People don't understand why. And so there are lots of people who are being missed out because of the way the criteria has been. And because when they get to school, for example, they're sat down very nicely. And the teachers say, oh, no, he's very good. No trouble at all. Not behaving well, without realizing what those people are actually going through inside them. So when you look at the diagnostic framework, it does miss out on a lot of people, because when people look at, it doesn't have this, so it can't have that.
Yeah.
Whereas when you drill deeper, you pick up a lot of things.
Wow. Because I mean, it's because a lot of people, I mean, the manifesting or presenting certain symptoms or signs of, diversity is somewhat frowned upon growing up. And a lot of people have to just, comport themselves differently and kind of suppress, even though it's like, it's, I mean, the day in the life of someone who's having to suppress and mask all of those symptoms, I can imagine how very laborious it can be.
Yeah. Can you imagine somebody in a class in Africa where the teachers would tell you to shut up and sit still? And can you imagine the challenges?
I mean, when we get into the conversation around ADHD, I think it's something we would again expand upon.
Yeah.
And I mean, speaking of executive dysfunction, which is a very key factor or key concept in particularly ADHD and sometimes ASD and the likes. I mean, it's often misunderstood as laziness or lack of motivation.
Yeah.
I mean, can you unpack the neuroscience behind executive functioning and sensory overwhelm? For the listeners who are trying to get their head around it.
Okay. So remember at the start, I said our brains are kind of, the driver for a lot of things we do. And our brains are divided into different sections. We've got different sections doing different things.
Yeah.
The front part of our brain, the part just above our forehead, near our forehead area. So if you open our skull, for example, we've got two halves of the brain. The part just near the skull, the front area, just extending a little bit upper mid part of your head, is called the frontal lobe.
Yeah.
Now that frontal lobe is so powerful because that's the part of your brain that is constantly checking you. That's the part of your brain you need to be functioning, what you call it, the executive director, because it helps you to plan what you're going to do, think ahead, organize yourself, motivate. It helps you to also regulate when you go somewhere to say, that's not right for me to do because there are consequences. I can't do that here. I can behave well there. And if you remember, we talked about the brain and neurons, that they have to be transmitting one to another and carrying that information. So for your executive function to be, that your frontal lobe is the seat of your executive function. Now, and you need all those wirings to be working well, the transmission to be going well.
Yeah.
For that to be doing its job, it needs to be carrying out all that function, one nerve talking to another, one nerve talking to another, saying this is going on well.
Yeah.
When people have problems with executive function like ADHD, that process isn't working well.
Wow.
So that transmission is not going on well. So that's why they struggle. They don't get motivated. They're chaotic. They're disorganized. They can't plan. You tell them today, they've got all the greatest intention. They can list things. They can do everything. But actually to carry it out, they struggle.
Wow.
And that's because that part of the brain functioning is not working well. And ADHD has a lot of executive function difficulties. That's why people with ADHD just struggle with that and they need a lot of help with that. They've got fantastic brain, fantastic ideas, but they struggle with that. Now, when we come to sensory problems, so we also have a part of the brain that helps us to actually filter things in our environment. So that's why you can sit in your room, somebody could be jumping outside, making a wild noise, a builder could be next door, you won't be bothered because your brain is filtering that well. The noise, somebody could be cooking, you know that there's somebody cooking, you can smell it, but you're still carrying on with what you're doing.
Yeah.
So you've got your sight, smell, touch, and all that.
Yeah.
You can wear things, you can feel things, but it may not bother you. People with sensory difficulties absolutely struggle.
Wow.
Because that filter is not present. So a little noise that you filter well would be like somebody's hitting them with a hammer.
Wow.
And so they're very sensitive because that noise is just hitting them straight on. So somebody doing a little tap somewhere would feel like their heads are about splitting.
Wow.
So they go into a place, a shop, the little noise that there's noise people are doing, you're going around doing your shopping, but they get there, that noise is driving them mad and they have to run out. There is no filter. That's why people with sensory difficulties struggle to be in loud places where there are big music. They struggle to go on the tubes. They've got to wear headphones or things to dampen that down. You know, they struggle with certain clothing.
Yeah,
you know,
textures
the
and stuff.
textures, because they wear it. It's almost like you're going to kill them.
Wow.
Some children struggle to wear uniforms to school because of the nature of the uniforms. So
Shocking.
there's a lot of adaptation, because those things could cause them to be so distressed, and their behaviors could be so distressing. So you would see a child crying and crying and crying,
And you can't figure out.
and you can't
exactly-
figure out what it
Wow.
is. Yeah.
This is good information.
Yeah.
This is definitely brilliant information. I mean, there's also a lot of conversations around, you know, neurodiversity, that's either ADHD, ASD or the likes, that it's just a temporary phase, you know. The child or the person will grow out of it. You know, when you get older, you just grow out of it. How would you, what's your reaction to such a commentary regarding people who say, oh, it's a temporary phase, or it's just it's a child problem. Once they grow older, they will grow out of it, you know, or people just assume ADHD, ASD or whatever is it's just a challenge that only toddlers or younger children face. Adults don't need to worry about it.
So I can certainly say, no, you don't grow out of it, because you don't suddenly get a new brain. You don't get new structures. It's still you. What happens is sometimes symptoms modify. So the young child who is running around, say the young child with ADHD who is hyperactive and running around and all that, when they get to the teenage level, yes, you don't see a lot of running around, but what the person now has is inner restlessness. So it's moved from running around, jumping over things, to your mind cannot settle. So that's why they then diverse to other things. And the child, some young people may now start doing other things like drugs and all that, because they're constantly restless inside. Their minds are everywhere. They then go to doing wrong things. So it hasn't gone away. It's just moved to differently.
Wow.
And then when you get to an adult, what happens? The adult can't keep a job. The adult is fighting all the time. They can't keep a home.
Wow.
You know, it just manifests. They go into drugs and alcohol. So it just moves the way it manifests. And I can certainly tell you, I've got lots of children who, following my diagnosis of the children, the parents have gone and gotten an assessment, because suddenly it stares them in the face that this is what they've had all the while, and they've gone for assessment in their adulthood and had a diagnosis. And that's telling you that those symptoms were present. You know, it's very common. Parents will say to me, oh, I was like that as a kid. Oh my God. They just used to tell us we were naughty.
So the parents themselves had to go get an assessment off of the insight that they've gotten from
the children. I've had that a lot.
Wow.
Yeah.
Wow. It's quite interesting information. So we'll just quickly pivot slightly to the talk around medication and diagnosis and holistic care. So medication for neurodevelopmental conditions is often misunderstood as a quick fix, you know, or the last resort. So it's either they see it as a quick fix, or, you know, after all said and done, they see it as a last resort. So how would you educate families or professionals about, you know, where medication fits in, you know, within the scope of neurodiversity? Is this something to maybe explore early when a child is still young? Or we say, how does medication, what's your position regarding medication and where it sits in all of this?
Luckily, we've got guidelines that guide us as professionals as when to use medication. So the first thing is always behavioral interventions. You do all those things that we talk about. Educate people, educate parents, because sometimes little changes you do. In fact, start first by understanding your child's behavior, because when you understand your child's behavior, you dial things down. Those things that used to make you get frustrated, you now understand it and seeing from a different angle.
Yeah.
The school as well would put in what we call reasonable adjustments. They will understand the child better, and they'll be able to make accommodation for the child. So the first thing first is understand the child. I mean, funny enough, just a little digression. I was talking with somebody and they were telling me how the negative experience they had taking their child to church.
Wow.
Children's church. And how they were told how naughty the child was. And once they came and saw the child, you know, standing by the naughty corner and all that. And that's, again, lots of churches have children's church. people there didn't understand neurodiversity. So making people in all places where children are understand and how to support the child.
Yeah.
Because the child will play differently in that setting to other children. Now, when all the behavioral strategies have been put in place and the child is still distressed, what we call impairment, so that child still struggles to function, cannot sit still at school, cannot learn, especially for children that you say there's a lot of potential, or a child where there's a potential risk of harm. And this is real. Children can be so impulsive. Children have had accidents.
Of course.
We've had young people die because of impulsivity from ADHD.
Wow.
We've had them die, literally people without insurance, ADHD, take a car, die. And therefore, when you see such impairment for that child, there is no amount of behavioral strategies.
Yeah.
You need to help that child regulate better. The medications that are used for treating conditions like ADHD are so well tried, researched, and tested, and they walk around improving the signaling and neurotransmission in the brain.
So that's what it does.
That's what the medications do. So we know what happens at the end of nerves. We know that at the end of the nerves, to help with the exchange of information, you have what we call neurotransmitters. Dopamine, noradrenaline. They are the ones that help the transmission across the nerve. When those things are not working well, you cannot get that information across. The person displays all those behaviors. So what the medications are doing is actually improving that transmission. So that child who is now impulsive and hyperactive and now suddenly becomes better able to regulate. And what do you get? You get a happier child who is able to sit down, listen, interact better with their peers. You find home situation even better because the child can now actually do things with siblings, with families. And the child gets happier because they're achieving better. Not all this negative being told of all the time, told of at school, told of here, told of there. So there is room for medication. And I always say to parents, if you're unwell, if you've got hypertension or diabetes, and you've been given medication, would you not take it? Would you not take something to save your life?
Yeah.
The fact that this is a hidden disability, that you can't see it physically, does not mean the person is not suffering. And it doesn't mean that it can cause harm, because children can't get so frustrated and unhappy with themselves. We've had children self-harming and all them because of the frustrations that they find because they're not able to achieve. And I've had the benefit of having worked in this field for over 20 years. And I can tell you, I've seen young children and young people from when they were little, when it was almost as if, oh my God, what's going to happen?
Yeah.
I've seen these same people as young men who've been successfully treated, who have lived a functional life.
Oh, wow.
And so I've seen where medication changes life. And we need to take a step back as families, as parents, to say, are we doing for our own biases, or we're looking at that child's best interest? And we should always think about the child's best interest, because they're the ones that are going to grow up and live in a society and a world as an adult.
Yeah.
And some children have felt really poorly treated by knowing that they could have had something that could have helped them and they were not given that opportunity.
Speaking of biases, there are a lot of parents who still have this fear of labeling. You know, there's still this fear about, I don't want my child, or I don't want, as an adult, whichever the case is, I don't want to be labeled. And some families also worry that diagnosis might harm their child's confidence, in the future, that once this child knows they've got ASD or ADHD, once it's been, officially, or once it's been medically, diagnosed or established, that it could affect the child's psyche or self-confidence. So I'd rather just not, what I don't know cannot kill me. I'd rather just not label them, because labeling could affect their self-esteem, or it could just bring a lot of, complexities around their education or their life's journey. So how would you help, or how would you, reframe this conversation regarding diagnosis that, it's not necessarily limitation, but it's liberation. How would you, rephrase that? Have you got any experience around such?
Yes, I do. And I always, this is why I involve children in the discourse when I do diagnosis. And I use a lot of visual things for them.
Right.
And I think that what has happened when people feel negative is just the discourse around what has been used to share that information with them. And therefore, them saying the negativity is what they then transmit and feel, I don't want to share that. But when you then turn that around and look at the child's strengths and say, actually, you've got fantastic skills in there. I had a young lady with ADHD and ASD who came to my clinic, and I was blown away because she was such a good artist. She was such a good, she used to do a lot of animation, doing it in her room.
Okay.
So much that she put it out once on social media, and then people in Silicon Valley liked what she was doing and actually were commissioning her work.
Wow.
So this was a girl with fantastic skills where she was struggling in everyday thing, but she had this fantastic skills that she was almost shy, but she had this fantastic skills. And I said, oh my God, look at what you're doing. And when we bring out the child's strengths and say, and highlight those strengths and use those strengths to foster discussions and say, look, this is just explaining how your brain works differently. It's nothing negative. It's just helping people understand how your brain works so that you don't have to feel under pressure to behave in a certain way. We want you to be you. We don't want to change you. We just want people to understand that when you do these things or do things which people think different, that it's just the way your brain works. And then we bring out all the positives for them. And I usually show them information about the brain and all that. And then tell them, there are lots of people. I've got colleagues with this condition taking medication. I've got lots of people at the top. So when they start seeing things in a broader view, and you tell them the positives that people with, say, ADHD, they're fantastic business people, they've got creative minds, they run successful businesses. People with ASD, they've got rare talents, they do this. When you bring out the positives, then you just find that negative discourse just paling away. And a lot of children have embraced this and are able to, you encourage children to be able to talk to people about their condition. Because when you empower them to share that with their friends, say, oh, this is how my brain works. Oh, yes, I've got ADHD, but, this is a good part. You give them that confidence, and they also offer some of support to other children around them.
Of course.
And this is what we are seeing. So it's about parents understanding and taking the positives and looking at the strengths and how to empower the child's strength. I did an assessment on a child in Nigeria once, and I'd been hearing this child is so negative and all that, and then they said to me, "Oh, she likes drawing." So I was so interested. They said she draws and all that. I saw on the video. I said, "Can you show me some of your drawing?" I was blown away. I said to them, wow, you mean you've got a child doing these phenomenal things? And I said to them, no, you've got to do something. You've got to encourage her. You've got to get her into an art school. You get to get her on courses. I said, she's got, and that girl's face, I would never forget, lit up. Because for one, she felt that something she had was extremely positive, and she wasn't. So because where they were thinking, she's so lazy, she's so this, executive function difficulties. So all those other things were being amplified, and what she had as her strength was hidden. And it's actually encouraging parents to say, you need to understand, you need to nurture that creativity within your child. That is their strength. Nurture the positive. Bring that out. It's amazing.
Yeah. From your experience, because again, like we've touched on previously about, a lot of people feeling compelled or feeling the need to just, mask their the expressions and, the way all of these neurons or whatever, however it's called, how it, manifests, and they need to like mask and suppress. From your experience, what's the downside of not acknowledging or not, affirming or not being diagnosed and having to suppress and mask, all of these potentials or all of this other, the downsides of it? Like, what experience have you got with it where there's a negative side to
So
it?
the negative side is eventually these young people start getting very down on themselves internally. And we've seen a lot of mental health problems come out of it. Lots of depression, because people suddenly feel they're failure. They feel they have not measured up to everybody else because they've used everybody else who people are saying are doing exceptionally well.
Yeah.
They've used them as a benchmark around themselves, and they just feel that they are no good. So, and then people not going to diagnose them to actually help to bring out the positives and help people support them makes it worse. So what we find is there's a lot of anger. There's a lot of and then this is where we've had lots of young people self-harming. We've had just some people just deciding, okay, I give
Just
up.
give it all up.
And then they've gone into drugs and
Wow.
that's the negative. That's actually the negative. And we have lots of young people in the criminal justice system.
Yeah, we're going to get into that at some point.
We've got lots
Yeah.
in there.
And again, I mean, with the good work yourself and, a whole lot of other practitioners are doing with, driving awareness around, neurodiversity, the ADHDs, the ASDs, and the other, manifestation of neurodiversity. On the flip side of it, there's also another bandwagon or another, community of people who's, saying that, oh, everybody's a little bit of AD, everybody's a bit ADHD these days. Everybody's ADHD these days. Oh, you're just making excuses. Everyone, well, you say you can't sit still. I can sit still sometimes too. I'm distracted sometimes, so but I make you work. Why you just, it's like people, as there's conversation around people saying like, oh, everyone is just wearing this badge these days just to, maybe get attention or whatever the case is. How would you, react to this commentary or these conversations around, maybe minimizing or also people just, self-diagnosing? It's like a very complex conversation right now. It's like, who's really ADHD, who's not ADHD, and what kind of support should be offered to people who are actually ADHD or people who are also undermining the complexity of that situation. How would you balance that conversation?
So and you're right. The discourse is when you hear certain things or you read certain things on social media, you just think, oh my God, because actually I usually start off by saying to people, please, there are people who have these conditions and are significantly impaired by it, who live it day to day, who, if you tell them that they are choosing to live that life because they want to get attention, I'm sure they would tell you otherwise. So in order to be diagnosed, you have to go through a formal process of diagnosis. And the diagnosis, so people can have traits, you can have a bit of distractibility, but you are not impaired by it. So what differentiates a little bit of inattention from a diagnosis of a condition is impairment. And by impairment, it means you are hindered from functioning to the capacity and the level you should have because of that condition, that disability. If you cannot do your work properly, if you're so distracted that you cannot sit down in class, you don't submit your work on time, and as a result you fail, you're thrown out of a course, and repeatedly that's happening, or you're in a job, you are not performing to your optimum, you're asked to leave your job, or you're having difficulties with your relationships with people because of your impulsivity and all that. So it is affecting you academically, socially, occupationally, your general relationship. You have an impairment, and that needs to be formally diagnosed and treated. So the distinction between somebody having a diagnosis is
Yeah.
impairment. So when people say, oh, everybody has a little bit of ADHD, no, not everybody has a little bit of ADHD. You might be, lively and all that, and you may not meet the criteria for ADHD. So not everybody has a bit of ADHD. Yes, there are people with traits, but you may don't have the diagnosis.
Yeah.
People who have the diagnosis are significantly impaired by the diagnosis, and they need a lot of support. They need support from the community, from their employers, from school. They need people in the environment to understand them rather than, make comments which are sometimes, quite negative. I have actually stumbled into comments people put on social media saying, oh, people are just getting labels for their children and all that. And I have actually gone into such spaces and said, please be sensitive because there are families who are struggling significantly because of the challenges they are having to face on a day-to-day basis as a result of their children's neurodiverse conditions and stuff, and having to manage that. So when that parent whose child can't go to school, who has not been able to work because their child can't go to school and they have to be a full-time carer for their child, that's quite an insensitive comment to make. So we need to be very careful. And for people who do not have the condition or people in the community, I say, please educate yourself from the right sources. There's a lot of things going on social media, people putting up on, but go to the right sources to get educated and understand what is in this condition. It is not a social fixer. It is not a celebrity status. It is none of that.
Yeah.
It is a truly impairing neurodevelopmental condition that people need to handle with sensitivity, and people need to do everything they can to support them, to support people.
Brilliantly said. Thank you very much for clarifying that, because it's very, very important. And still on topic of diagnosis, what's the roadmap or what's the framework? So for anyone who's probably listening to this now can resonate with it, be it a parent or an adult or a young person who feels like, I think this speaks to me some way, somehow. What's the roadmap or framework to get a diagnosis? Of the timelines, the steps, the different, pathways. Where do you begin your journey?
Yes, so we're actually at a time in the UK where I think in most places actually, but in the UK, there is such a huge demand and therefore very long waiting list for diagnosis. But in order to make that process easier for people, obviously in the UK it's such that for you to get an assessment, you need to go through your GP in the NHS.
Okay.
And for the different parts of the UK have different pathways. So it's important you go to your GP because your GP would understand your local pathway. But one of the things that makes it useful is actually going to your child's teacher. And if your child's teacher, if they've been raising these concerns, it's good to ask them for a letter, just summarizing those concerns that they've noticed.
Yeah.
And then taking that letter from your child's teacher to the GP, and then the GP makes a referral to your local pediatric service, or child and adolescent mental health service for the assessment.
Okay.
So the only way you can get into the specialist services to get an assessment is through the GP who refers in. But the GP needs some supporting information. So it's good to get that information for young children. For an adult, you obviously you go to your GP yourself, you express the consent, and it's good to have that information quite clearly. Tell them you've had this consent for a long while, but you've just been understanding it more now and why you feel that you were significantly impaired by it.
Yeah.
Tell your GP how it is affecting you on a day-to-day basis, your work, how, getting a diagnosis or an assessment is important for you because you feel that you are failing at your job, or it is impacting on you, mentally, socially, and with your work. And your GP should be able to refer you to the services.
Yeah.
Now, there is a very long waiting list in the NHS. There are independent services out there.
Okay.
And before you choose again, I would say research that independent practice, because we know because of the increased demand, there are also not so good independent practices out there.
Okay.
And make sure that you are seeing people who are actually going to do a proper assessment on you, not just a tick box thing, somebody who's going to look at everything, and that these people are reputable, they're specialists in their field, they're not just people who've just set up and just doing an assessment.
Yeah, I mean, from my experience or conversation with certain people, people who want to explore a private route to get an assessment or diagnosis, or in other climes, people in other climes that don't have access to like an NHS type service, people in like Nigeria, Africa, or some other environments who don't have that kind of system and want to explore a more private route to get diagnosis, which could be quite costly sometimes. So how would such a person balance the cost and the benefit of getting a diagnosis? Ultimately, what's the benefit of getting a diagnosis? What does it serve, or how does it better their lot?
Okay, I would say that there's definitely benefit in getting diagnosis. So when I've done these assessments, even for people in Nigeria, sometimes families have almost been at breaking point. Children have had to change schools several times. Children have become very vulnerable and at risk because of impulsive behaviors. And this has literally almost torn families apart.
Wow.
So when you're at that road where you see a potentially bright child who is about just being thrown out of school and not having a future, you know that diagnosis and treatment can change that trajectory.
Of course.
You would do anything to rescue your child from that road, that other road that they would have taken.
Yeah.
And I have seen adults where, unfortunately, you think, oh my God, this is such a person with huge potential.
Yeah.
And you think about, gosh, you still got so much in you that you could do, but because of this condition, if you think about how much they've lost in terms of things they've lost, both financially, physically, socially, and where they are now, because of that condition, it is worth it. Because it's never too late for somebody to pick up and retrace their steps and live a good life and fulfill their potential from where they are. So my saying is, if that person's got significant impairment, then it is important that is taken forward and an assessment done and treatment done. It can change lives.
So I mean, it's many areas I would still want us to delve into, but again, we're gonna have a part 2 to this. So just to round off, so I mean, you're uniquely positioned between the clinical practice and community education. So how would you translate the complex medical language of that neurodiversity to an average parent who's trying to understand their own child's behavioral their child's behavior and trying to make sense of it? So what are the key indicators of ADHD or ASD for them to start to observe, to begin that journey of, okay, maybe how can they validate, confirm that, okay, I think this is ADHD or this is ASD? What are the key signs of ADHD and ASD, just briefly, so we can just establish that?
I would say that these conditions, they're called neurodevelopmental because they start from very young. And as parents, we're privileged to have known our children from when they're very young and observe their behaviors. If you observe that your child is, say, for example, when they're younger, so, say, completely very hyperactive and restless, that no matter what, even when they're playing with other children their age, and they're kind of different, they're They're the ones that are, disruptive. They're ones that are just cannot sit still, continues to be disruptive, and it translates in other settings that you go to, like in school, they're noticing it. Because the good thing about school is that everybody about the same age is in the same class.
Yeah.
So you can see where your child's behavior stands out from everybody else. If that behavior is beginning to impact the child so much that they are not able to have friends, the child is not being, nobody wants the child anywhere, or in school they're constantly in trouble, you are constantly being told something about your child every single time.
Yeah.
And that child is so inattentive, can't sit down, even to play, even the things they like doing, they can't settle to do it. And it is affecting them all the time. Then I think you should begin to think, is there something else going here? Should I?
Yeah.
Now, for the child with ASD, you might notice a child who does not like to, does not like people around them. So they're happy with just nuclear family. If other people come in, they get very distressed. They don't want to go out. We might want to go, family day out and all that. They're completely distressed until you leave that place. They cry all the time. They don't like certain things. They're very fussy, maybe about certain foods. They won't eat some of the times. They won't even want to eat. They don't socialize. They don't like other children around them. They're very engrossed in doing one thing a lot of the time, just the same thing. And if you try to change anything, they don't like it. And they notice the same thing at school, and the school is saying this child is not integrating.
That's most likely ASD.
Just think about what else could be going on here. So these are just some of the subtle signs that we'll talk about today.
It's a very powerful conversation. I feel it's very, it just makes, it puts things into perspective and just, opens up this conversation, which again, we're going to have a follow-up to this episode, and it's going to be, in a series, like we said from the start. And we're going to, deep dive into ASD and ADHD even more, more in a more robust manner, and just give more information, and hopefully, save lives and, save homes. Yeah. Thank you very much again, Dr. Inyang, for this conversation. It's been very, very engaging, and I love it. And I'm sure our audience also find it very, very informative.
Thank you.
So until next time again, tune into Can We Talk and have more conversations like this.
Yeah.
Thank you very much again for your time.